newborn baby has two needs: the warmth of her mother or its mother, and the breast that provides food for the baby. So we started with the first series here at CSA Table, where we listen, learn, and connect to know better what support is required for a baby. And in the first series, we talked with men. We had a very good dialogue, and we got to know what they understand when it comes to breastfeeding support. We're now in the second series, where we are talking with different women from different cadres for us to understand then what is the lived realities of women when it comes to breastfeeding. As you do know that 60% is the statistics of Kenya when it comes to exclusive breastfeeding. We are way above the World Health Assembly breastfeeding mark, which is 50%. So, but then again, we've plateaued at 60% since 2003. For me, I think it's a questionable thing that we should be able to talk about. Are we having the right data? And that data, has it compromised, has it brought in different people, the teenage mothers, looking at mothers who do have children who are neurodivergent, having cerebral palsy? And then we want to know, are the interventions being done by the government being scalable for us to say, yes, we are at 60% or we should increase. So my name is Charlotte Kirui, and I am the founder of CommWave by Chalet. And today we are going to unpack better what this intergenerational podcast is trying to talk about, the support we inherit as we support this year's World Breastfeeding theme. So I would like to introduce our guest, and I'm going to give you your own, according to your own volition, how you want to introduce yourself. Do you want to say you're a mother? Do you want to say whoever you are? We may start with you.
Thank you, Charlotte. Is it Charlotte or Charlotte?
Charlotte, potato.
Okay. Mm-hmm. So my name is Lilian Momina. First, I'm a registered clinical nutritionist with Momina Wellness. I also serve as the National Treasurer of the Kenya Union of Nutritionists and Dietitians. And apart from that, I'm a mother. So of course, this is a conversation that is both personal and professional. So I'm definitely glad to be here.
And I thank you for saying that, because the way we are going to unpack with you, it's because you sit at that intersection. There's that support you need to give to the mothers, and there's the support you needed as a mother. So introduce yourself.
Hi, I'm Maureen, a mother of two boys. I'm also a mother of a special son who is 11 years old with cerebral palsy. Thank you so much.
Thank you for being here.
Oh, hi, people. Thank you, Charlotte. My name is Masinjeri, community advocate. I am a mother, and of course, I am a grandmother looking at me. So that means this intergenerational conversation on breastfeeding touches from ages gone by to contemporary. Thank you.
So then from you, we'll get to know if you're spreading the right message within your generation. Okay, thank you. So you as women and you guys as mothers, I want to take us back to when you got to know that I am pregnant. How did that feeling, how was it? Lilian,
you want an honest one?
Yes,
I was very shocked. I think I was expecting a mango, not a baby, from whatever I was doing. But when I got to know that I'm a mother, being a nutritionist, I will say that my nutrition was good even prior. So of course, the first thing that I did, because I know better, I did not wait for what we are actually told, or what women are actually told, to wait until the bump is visible for them to go to clinic. So me, I didn't even go for NC, but that's the bad thing, but I went to a pharmacy, got my prenatals, and started on immediately as I figure out what to do. So that is what I think, if now coming in as a professional on how breastfeeding nourishment for the woman comes in, I think that is a gap where majority of women fail without knowing, because there's this notion that our mothers and even us currently have, that when a woman goes to the clinic before the bump is visible, she's akona kierere, unaona, ameenda mbio sana, anataka kusumbua watu, hana need ya kwenda hapo. Women are actually told to wait until 6 months ati ndo uende clinic. So I think that's a problem.
I think that is one of the myths that I want us to debunk in this podcast series. And I love the fact that you're honest. Even you as a healthcare worker, you did not go for the ANC visits, but then you'd still say that it is important. It is very important. So I would also like to pose a question to the viewers. You being a mother either in healthcare, but a working mother, did you also go for NC visits? And if you did not, what hindered you from going for the NC visits? To you, Mercy, then I'll come back to you because yours has a different touch to this conversation. Mercy, you've seen, don't know how many generations is within your household, but then how did you feel when you got your first baby, and how did you feel when your baby got a baby?
Oh, thank you. Those have been very great experiences. And I want to go back to what Madame said during her first day, how she knew whether she's pregnant. During our times, we had been taught to listen to your body. And listening to your body, remember in those olden times, we did not have this much vast counseling. We were not told about this much going to the clinics. We didn't have a lot of health facilities. So the first step was to listen to your body. And your body never lies, so we could tell the change in our bodies. But we were glad to be able to uptake the counseling we had gotten from our grandmothers even. Personally, I was brought up by a grandmother. And so I was very articulate to this, and I felt that my body is changing. And next, I could go see a doctor. And, thinking it is a stomachache, little did I know this is a baby in my womb. And of course, it felt, wow, I am now getting into a new world of motherhood. And from then on, when I visited the doctor, I didn't know it's a clinic. Actually, I didn't know it's a clinic. The doctor advised that I have to take these CNC clinics. And of course, I went on. And to the date when I delivered my firstborn. Fast forward, Charlotte, yes. Please. You asked about how it felt being a grandmother. Mm-hmm. When my first grandchild was being born, I did not sleep that night because again, I was being ushered into another new world. Mm-hmm. We're gonna walk a journey, and I have to teach the mother how to breastfeed, and I have to also pass this knowledge about breastfeeding from our generation and from my grandmother's generation to her generation. Mm-hmm. Thank you.
I like the fact that you said the listening parts to our bodies as women. I'd like to share personal experience because again, there's the clinical part of it to listening to our bodies, because there are some people who get to know very late that they are expectant, because there's a time when I did have a stomach ache, but the first thing my mother thought, did you have anything? If you get it. So there is also the clinical part of it, and in the third series, we'll be having technical experts who will be able to help us understand better than what is this listening to our body, but does it have to end there? Do we only listen from the intergenerational part of it, or what is the healthcare that is needed for us to start the NC visits as early as possible? So to you, you have a very beautiful story that most mothers, maybe they're going through it, but it's a silent narrative that I want us to actually advocate for. For you, I want you to answer from this perspective, the time that you gave birth, because I'm pretty sure the expectant part might be the same, but the time you gave birth, how was it for you, and when you got to know that your kid is able differently?
To begin with, mine was not a wow thing that I'm pregnant, because I conceived I think I was around 23 years old. I was still young, still in college. My journey from kupata mtoto, I didn't have any difficulties or any challenges. It was just like a normal pregnant. And when I gave birth to my son, he didn't cry. The first cry is just considered like the golden cry, because that's when the oxygen, he gets to like inhale the oxygen and travel through the nerves and up to the neuron. Mine didn't cry. He lacked oxygen. It was a distressed baby. A distressed baby is I was supposed to like give birth like 4 hours earlier, but they prolonged the duration, whereby when I gave birth to him, he was half dead and half alive. It took around 20 to 30 minutes for him to like have the golden cry. I remember when he came out, the nurses rushed and took him. I was left alone in bed. I couldn't hear my son cry. I couldn't hear a cry of a baby. And as per what I had seen, each time a child will be born, they will cry, but mine was not crying. And I was like, why? Mbona wangu ali? And it was like, I could hear them talking behind me saying that, these are distressed baby. Hajalia, he like to have kumchapa ndo alie. Alipata some slaps, and then afterwards he cried. After he cried, he was rushed to the incubator because his oxygen was low, meaning that he could the oxygen that supposed to supply in his body was not like the normal child. So after they rushed him to the incubators, it took me like 3 hours before I could see my son. After seeing him, I asked, what could be the reason. Remember, I'm young, sijui, I've never had a baby, I've never had that experience. So I was like, why is my kid in an incubator while other are being presented their kids? And I was told like they have to take some tests to know why the child didn't cry. Afterwards, they took some tests. It came out like the calcium level was low. That's why the oxygen supply was not, like the normal supply. I never knew that low calcium, like for a mother, can cause some damages to the kid. Yeah.
Allow me to stop you there, because you've really been able to show how the healthcare workers bring in the support. But then I want to know the support that you got from your family.
Yeah.
Did anyone make you feel like you are a bad mother? And also the question will apply to both of you, all of us here. Have you ever been told that you're a bad mother, or have you ever felt that you're a bad mother because for you didn't hear the first cry?
Yeah.
You felt like you let that baby down because of the calcium. For you, let's say if you had an issue with milk supply, did someone come ratting in your ears, hey mami, mbono utoi maziwa? Did it make you feel some type of way? I'd like to understand so that we can really know where was the missing mark of that support that we're talking about.
Okay, I never got stigma from my family because first of all, none of them had a special kid. This is a new journey we are beginning with. I would say the only stigma I face is from the outside, the society. Because I remember there was this time I was coming from a therapy session and my kid would cry. For those who know, a CP child, especially with high muscle tone, they tend to cry a lot. And I sat next to a lady. She was a 50, 60 years old lady. And my son would cry nonstop. I would like breastfeed the kid, but hanyamazi. As women, we know, mtoto, if the pamper is dry, if ako in a fresh pamper, na ame breastfeed, supposed to like nyamaza. And I'm like, mbona mtoto wako hanyamazi? Shikilia mtoto vizuri kichwa. You see, like my child, how could develop the milestone like the normal kid develop. Like for like kushikilia, support the neck, it took him longer.
Yeah. Like
any other baby. Now it's hard to like keep on telling people kwa matatu, hey, mtoto wangu yuko sawa, shingo haishikili. I think the only stigma I faced it's through the society, but the family, no, they were very supportive.
Okay.
Yeah.
Good to know that. And Mercy, I want you to give us from the perspective from your grandmother. That's a different generation. Was there stigma at that point when you got your kid? And from the learning and unlearning you got from that, did your grandkid, or rather your kid, face any stigma while raising your grandkid?
Thank you, Charlotte. Okay, my kids did not face any, but I thank Maureen that she was able to identify early on, and I even thank her because she has brought in the aspect of calcium, because we're talking about nutrition in breastfeeding, yeah? So probably as we converse along, she will tell us about this calcium deficiency and probably the effect it had on the child. For us, for me, it was just the normal one. It was just a normal child. My grandchildren are normal. So the breastfeeding continued normally. But of course, there was that, there was the social norms. We call them social norms, that you're expected by the elders in the society to behave in a certain manner. Now that you're a new mother, even when breastfeeding your child. Maureen has talked about, moving around with the baby in a matatu. It is not easy because if you don't hold your baby well, you don't breastfeed, or your baby cries. Even when we are attending the postnatal clinics, the people in the matatu or the fellow, passengers in the matatu, they do not want to hear your baby cry. And you hear someone shouting at you, hey, wewe nyonyesha mtoto. They're like, I mean, do you know, you don't even know the schedules of this baby.
And sometimes it's not only the milk, the baby cries because of several issues, right? I think, thank you for bringing that up. And then I want to bring it back to the viewers. What is the taboos and norms that you know about breastfeeding that we need to debunk. One that I'm going to bring for you is that a big breast does not mean that you have more milk supply, and the left breast is not for the man. Both breasts are for the baby. Yes. Okay, Lillian, you sit at the intersection of healthcare work and being a mother. What stigma did you face at work and also being a mother back home?
The work that I do, I will say I'm more in the male field or male-dominated field. So basically, when I gave birth, currently I'm in my postpartum era. So nabebangwa kama mayai. That's the kind of stigma I think I have faced as a professional. Because ideally, I am those type of people, and I usually encourage women to be like me. Know that if you're doing your best, it's good enough. You know, when you're listening to advice from someone, you listen from advice from another person. Just before you let it soak in and determine how your day is going to be, how your response is going to be, just think about if it's good for you, you know. So me, when I got pregnant, I like the fact that she has brought in calcium. I told you I did not go for ANC firstly, but I ordered my prenatals because I understand that I had to have my iron, my folate, my calcium, my other prenatals. And I thank God that the country is currently trying to bridge that gap by coming up with multiple supplements for women, for pregnant women. But unfortunately for majority, even she can testify, majority of women do not start prenatals on time. And in as much as, yes, there's an issue of delayed births for cases like CP, we have other cases like malformations, we have other cases like degenerative disorders that can be affected by the woman's nutritional status. So I think, I think what failed me is what could have failed me if I was not a nutrition would have been the healthcare system. Because you see me, I went in, and when I went in, going through my ANC, no one talked about why I'm taking those supplements. You know, if you don't tell someone, I want you to take this because of this and this, and you're just giving them, they call them medications, za chakula, you just give them supplements and you tell them to go home and take them, and you're not really engaging them to make them understand why they need to take them. And then when they come in and they're not taking, you have disorders, unaanza kublame on mama.
So let's take to that supplementation. You've brought in the MMS that now the Ministry of Health is actually advocating for because it has extra supplements to it compared to IFAS. Do you just mind giving us an overview of what IFAS is and what MMS is bringing in?
Now, IFAS has been for the longest time been the supplement that is given to mothers in public facilities and even in private facilities. So it's basically iron folic acid supplements. And this is basically to reduce the degenerative disorders that occur between the first few weeks of pregnancy. And as I've told you, the gap or the window of the opportunity window is usually closed for most women because majority of women will go to facilities after the 28 days of pregnancy, you know. And IFAS is supposed to bridge that gap. If you're a nutrition, or if you don't understand, it's supposed to help reduce the cognitive or congenital disorders that occur during the first few weeks of pregnancy. Now, the multiple supplementation for pregnant women now comes in with calcium. It comes with other micronutrients like B vitamins, and these are basically to ensure that even with the nutrition that the mother is actually encouraged to take, they're actually supporting and bridging the gap so that this baby, akisha maliza kuanza kuform, they're forming well, their bones, their skeletal muscles, their brain, everything is forming as it should. Because unfortunately, as a country, we have people eating, but they're not eating what they're supposed to. And another thing, our food quality has degenerated, imeharibika over time. So you find that our mothers, even those mothers who believe that whatever they're eating is enough, I think this is where the ministry is going to need a lot of, I don't know if it's champions or a lot of podcasts like these ones, where they're going to try and reach that mother who is there, who's shocked. You know, sometimes, as you've said, we have teenage pregnancies. Yes. And these statistics, they come, I will say they are some are cooked. Mm-hmm. So they cook them in bedrooms and they forget to include those teenagers. They forget to include those people who are pregnant out of wedlock, and our society blames them. So mtu anaficha mimba, anafanya kila kitu ku avoid
and I want to stick to that statistics, because I really struggle with policies that is always formulated, so many acts, legislations, and then we come and just talk about the data. One thing that I want for us to move away from, we keep on commemorating days like it's a festival. We have World Breastfeeding Week. Then when there was 60% exclusive breastfeeding, full stop. But then there's Cavil Consulting publication, of which they did on the practitioner's perspective that you've spoken about, on the Kenya Health Information System. And that is a very big gap, because there are two core findings that I want to bring to this conversation. The missing adolescent indicators. It's completely missing from KHIS, you know. And then there is baby-friendly community initiatives that it's given there, but then the gap is, there is a very big gap when the counselling ambiguity that is given to these cohorts. And then another research, finding rather, that came from that research is that the 60% is stagnant, is also marked by lack of age disaggregated data, which means again, we are failing to account for the poor breastfeeding success of adolescents and other mothers who are also experiencing whatever you're experiencing, Maureen. So then, Mercy, as a community advocate, I want to know what is the voice of the people, because this is the episode where I want us to bring what is the lived reality, so that when the experts will be coming here, they'll now be talking, this is what the community is saying, but this is the data you're bringing to us. It does not tally. What is the community saying?
Okay, thank you. Through the community lens, data is very good, yeah? But when it comes to the community, the reality is different. I've heard her talk about teenage mothers. We have a lot of those teenage mothers. And I can tell you firsthand, a lot of them do not attend those clinics. And sometimes it's lack of knowledge or ignorance, or they just don't want to. You know, the millennials with Gen Zs, when they make a decision they don't want to, they don't want to. So this data, it works at higher levels. But when it comes to the community, people still continue to do things the Kienyeji way, the traditional way. And I say that without fear, because I have handled those mothers. You have mentioned about baby-friendly community initiatives. Like where I come from, we have one. We have mothers that we work along with, young mothers who are breastfeeding. And you'll find that a mother, actually one time a mother came to my house. She had a little baby, 3 days. So I am looking at her and wondering, what is it with you? Mtoto amekataa kunyonya. 3 days. This is a teenage mother. I asked her how old she is, 18 years.
Are you telling me she did not have access to a community health worker, community health promoter?
Lack of knowledge. Let me tell you.
Because the ones who are supposed to
Let me tell you firsthand, because it's a real case. There was, of course, a promoter around her area, but she was not reachable. You know why? Most of them, where I come from, and Maureen would attest to that, they close themselves indoors. As she said, sometimes they try to hide their pregnancies. They don't want to be seen until they give birth, or one day to give him birth. That is when they're coming out. So we also have a lot of cases of teenage mothers who are not even attending prenatal clinics. So they do not also get this counseling about how to breastfeed their children. And that is why this young girl came to my house, because she did not know how to breastfeed. And she did not know, kwa nini mtoto hanyonyi 3 days. She is scared, she has not slept, she's a new mother. So you can imagine the stress, postpartum stress we call it. So, you know, now had to walk her journey of, she had to go to the clinic. You know, they had to be diagnosed. And I sent her, I referred her to the nearest health facility in our place. So we have, this is something that is ongoing. So data may be there, but come to the ground, mambo ni different.
Mambo ni different kwa ground. And then again, I know that is the work of the community health promoters to provide that information, but then I'm going to back them up. They have a lot. Because I think one community health promoter covers how many households? Is it 100, right? And I can imagine some places, maybe they even cover more households. And Maureen, did you get to have that information when you got to know your kid now has cerebral palsy? Were you really guided from a health perspective on what to do, hearing Mercy speak?
To be honest, no.
Okay.
After I had... my son would cry like the whole night, and we would wonder what's the cause. We took him to one of the hospitals, but they couldn't diagnose it. I remember we saw a pediatrician and they said maybe he has some, colic. We treated colic for almost 6 months until one day we visited a private pediatrician, and that's when we got the diagnosis that he had the cerebral palsy. I never knew what cerebral palsy was. I had to Google. I remember that time I was still with my partner. He's the one like took the most initiative of knowing what cerebral palsy means. I would say like our society or our clinical officers are failing us, are failing the mothers, because kujua ya kwamba mtoto kutolia inaleta madhara kwa mtoto. First of all, kwa hospitali, I believe before you are given the leave to like weenda nyumbani, I think it's best if they go deeper. Because for me, I never knew. I would also think like maybe mtoto wangu akona tumbo, shida ya tumbo. Maybe mtoto wangu akona fever. In fact, if you would see my cabinet ilikuwa imejaa dawa za tumbo. Until one day that I came to know that it's cerebral palsy. And then I think the reason why ilispark hiyo reason mbona mtoto analia, my son was so spastic. And I would like, hata kama sijalea mtoto hafai kujikaza kiwango hichi. So I think our society or our clinical officers, as much as tunataka kublame how watoto ni ignorant, remember these kids know nothing. Like me, I gave birth at a very young age. Maybe not that young, but I never knew kuna some diagnosis of whatever nini inakam na mtoto. So let us, as also mother, let us take that initiative of like educating people. As much as hata kama hakuna mtoto yoyote amezaliwa na shida yoyote kwa society, let them know kuna wakati mtoto huzaliwa na hiyo shida. Si lazima tikwe ni specific, kwa sababu like for time yetu tulikuwa people would say like maybe umepata mtoto kwa sababu kwenye mkona hiyo shida. But no, but I think it's best if our clinical officer would take that your initiative ya kudig deeper. Let them educate them, hata kama hawajapata watoto, especially hao wenye wanajipata, let them wanajificha, let them know that kuna madhara ya kutoenda clinic, kuna madhara ya kuzaa, kwa sababu like mine was during birth. It's not like something that he developed while he was still, it's something that the delay, the negligence from the hospital too, because ilichangia pia. As much as we want to changia that calcium took part of it, but I believe that if they took that initiative of rushing me to a CS, maybe mtoto wangu angekuwa sawa.
Charlotte, if you'd allow me to interject.
Yes, please.
If you'd allow me to interject, we are conversing about the support we inherit. And listening to Maureen's story, it tells you a lot. There are a lot of gaps. We have really not inherited this support, and especially to matters breastfeeding, and probably not only lactation, even to pregnancy. So a lot of work has to be done. So the data you're talking about, it could be there just hanged on a wall or just lying somewhere in the files, but coming to the ground. Because I think the essence of this conversation is talking about the steps that you should take or the action that should be taken. We are talking about systems. And when you're talking about systems here that should support, you're talking about the individual mother or the real mother. We're also talking about the newborn. The other system is the family, probably the father or the siblings, or even the mothers and grandmothers like me. And the other system, of course, is the community around. Maureen has clearly put it that she did not have a community touch during this journey. And besides the community, of course, the government. And besides the government, every other stakeholder. So we're talking about systems here. Seems that much has not been applied or implemented. So whatever we're talking about, the support we inherited, I think when a new mother gives birth, it is a solo journey. It is your own journey. Find out the facts. Find out to bring up your own child. Find out how to position your baby when you're being breastfed. I see a lot of teachings around and a lot of seminars and a lot of forums about how to position your child when you're breastfeeding. Ask me. Personally, I was not taught how to position my baby when I was breastfeeding. So this inheriting leaves a lot to be desired. There's a gap there.
I do agree with that. Lilian, you're going to pick it up. Because when you speak about the systems, you've outrightly put it how I wanted us to talk about it, because for the government, are they even prioritizing the budgets to ensure that we have more CHPs on the ground to share that knowledge? For stakeholders, are they just coming to tick boxes and have interventions they finish, then once they're done with that, They just give the indicators to the donors. And then for the community, are we also working together to support mothers, fathers to also feel like we can even have our own father-to-father support groups so that we can understand. And one thing that I've gotten from you too is that maybe your first pregnancy might not be the same experience in your second, right? So I'd like to hear more from you.
Now, allow me first to address the issue of where she said that she should have had more community health promoters. You see, the idea of universal healthcare is now making sure that we get to the grassroots. The grassroots is where we are supposed to now get someone from the community, they are handling households, and then they refer. So when we overburden this community health promoter, remember this is someone who has not trained on matters health. This is someone who has been identified as a champion of the community. Kama mtu mwenye anaongeanga sana kwa community. They do not necessarily have a health background training. So they are brought in because they are perceived as people who talk and the community listens. So when the community health promoter comes, they're supposed to help with identification of the problems. So when they go to the household and they identify that there's a teenage pregnancy, they're supposed to refer that teenage pregnancy to the next health facilities. Now the problem comes in, as you have said, with integration or support from the government and our systems. Now when this government, the community, they have ambush the community health promoters. They want them to do everything at the community. They have not established chains that are actually moving, where the community health promoter is able to refer to the community health assistant, who will actually now take to the healthcare level or the health facility where this teenage mother or even me as a pregnant woman will be actually addressed. And she has said that she did not receive teachings about how to position a baby. I gave birth. My baby is not even 4 months in a very good facility. Not very good, but it's a level 4. It's a level 4 facility in Nairobi. Nairobi, the capital. And this level 4 facility, from the time I was going for my ANC, I did not meet anyone who talked about breastfeeding. It was not a public facilities. I think that is one of the problems, the challenge that we have. And remember, women in urban centers, 70% of us, 70 to 80% of us are sourcing or are going to the private facilities, because we are scared of the shouting in the public facilities, or we don't want to wake up early in the morning, tuende tukasomeshwe pale kwa venye tunasomeshananga wa mama. Now, hiyo time when after giving birth, because I understood how to position. This was my second baby. Even with the first one, I still had to ilibidi niweke practice theory to whatever I was talking before. Sasa kukua the dummy of that practice. So the second time, my attachment definitely was better. But akuna, where we were two in that ward, the other lady alikuwa anakuja ananiuliza wako anashikilia je matiti. Unaona, wako anashikilia je matiti cause wake hakuwa anaweza. And the assistant that was there was very minimal. Ilifika hapo when she was even referred because she was not breastfeeding. So I think as we talk about the generational or the intergenerational inheritance and support that we have, there's a lot that we need to correct. Kuna loopholes mingi sana. She has talked about clinicians failing her. There's clinicians might have failed her, but again, in a public facility, I can assume the way they're usually so jammed. Yeah. So it's easier for me as a mother to say that those doctors at Mama Lucy, those doctors at Mbagathi, those doctors at this facility failed me because that is what I see. But atuoni the fact that the government, as you have said, they have not brought out the chains to ensure that kuna funding, to ensure that watu wanaelewa. Even this mother, when you don't know something, alafu shida ikuje utaumia. And you will have, some people will start blaming themselves.
And all this is a systemic issue that we are trying to turn a blind eye, that we can be able to actually solve. Because I always believe that the problem-solving skills that the community has is what should be skilled. Yeah. Because again, we have already established community structures. We have chamas, we have the village savings and loan associations. We have, I don't know kama kuna wababa, kuna malezi bora and other interventions that I want you to speak about. But Maureen, were you part of any community structures that supported you to get that information, the referral pathways that Lillian is talking about?
Before?
Yes.
No, I would say no. I wasn't in any. Yeah.
Has it pushed you to be an advocate to start?
Yeah.
And how have you taken it up?
Yeah, it has, because most of the time you will bump into mothers who have like the cases like I have, and some of them they don't know the definition of the cerebral palsy, and it helps us a lot who have already gone that journey to like tell them even ndivyo kunafaa kwenda. Na us joining and having more groups of cerebral palsy has also helped us to like reach out those women like wenye wako huko ndani kabisa, wenye hawajapata hiyo education ya kujua this a child with cerebral palsy anafaa kufanywa hivi, like because the way you take care of a special need kids, not like the way you take care of another of a well baby. It takes like a village for you to like raise that kid, because like some of them are non-dependable. They have to like depend on you like 24/7. So you have to like feed them, going to the toilet. You also have to like know when he's in pain, when he's hungry, when he's angry, when he's happy. So yeah, I think it has really helped us to like educate others, and it also makes us happy to know like wewe mwenyewe umejua this is how to like handle this kid. Yeah, because it's take a village. I'm telling you, it's take a village. Because as per now nimehave kuacha mtu na mtoto wangu. So I'm like time yangu si time left. I'm sorry to say, like my schedule is not like hers. For hers, like amekula, amenyonya, feed there. Is it okay? For me, I have to be there to know like umtoi amekuwa poa, and each time you get home, you like to like wanna take time to like study him. Ameshinda poa? Is he in pain? Yeah. Yeah, exactly.
I hear you. And then back to our viewers, one size does not fit all when it comes to breastfeeding support and even strengthening the systems. I'm hearing a lot about this happened to me. It's not the same for this teenage mother. It's not the same for another person. Mercy, I want to know more about the work you do at the community level. What are the interventions that are really working and are scalable before I can be able to mention what the government is doing? Then you see if it's really what is the real lived realities on ground.
Thank you, Charlotte, yet again. Maureen, I want to depart from where she mentioned that it takes a whole village to bring up a kid, and that one is a reality. So that means back in the village or back in the community, of course, we have interventions. We want to leave the theory. We want to sort of, leave it to the books and leave it to the class, because it takes a village to bring up a child. Back in the community, some of the interventions that we have those support groups, what you call mother-to-mother support groups, which we also assisted, initiate. And why? Because we looked at the young mothers, and then they're bringing up their children and the challenges they're going through. We called them together. We told them, come here. We want to talk to you. And you know what? Those young mothers are wonderful beings, because they had us and we came together. It wasn't a chama. It was just a come together. Let us walk this journey with you, because we have been there before. And like in my community, we brought up that group, Magana Malezi Bora group. And it started in 2023, just after the COVID time. And it was very difficult for them. And you know what? Even during the COVID times, babies being born, babies are still being born.
Actually, the teenage pregnancy did spike during that time.
Thank you for that statistic. It did spike. So as a mother and as community mothers, we looked around and said, no, something is wrong here. So we brought these young women together, and we were like, what challenges are you really going through? Can we as the elder mothers and those who have gone before, help you walk this? Can you trust us? And you know what? They did. And we started working with those groups, mother-to-mother support groups. We would sit together at a communal place, at the chief's place to be very precise. They would come, we would meet, we'd cook together. We would show them how to, feed their children, even how to breastfeed. And I am telling you, initially when we set up, we didn't think it's going to be a big thing. But they came in with a lot of issues, even the husband's issues, even when to breastfeed. For how long? And this is why I say without shame and without fear, that breast remain for the child until 2 years and above. Please, husbands, hi. So, they came in with a lot of issues that some of us had not foreseen. And we worked with these women. And we were like, can this be replicated in other villages? Because they loved it and they started coming together. Actually, they meet on Wednesdays And basically to talk, it's not a term of toaing pesa at table banking. Is talking about how best to bring up their children. How best, nasikia inaitwa malezi bora, kulea watoto wao bora. Why? Because a child belongs to the community. I want to also give a case, if you'd allow me, of a child that was born in my house. And little did I know that this child is gonna be born in my house. So, you know, someone called me from where I had a shop across my house. And someone calls me, hey, mom, come. And I was like, what is it? No, kuja. And to go to my house, a baby is being delivered. Because I'm a community mother, my house is accessible 24 hours by the way. Karibuni. So ninaitwa, mtoto anazaliwa kwa nyumba. Kuna mama hapo ame-identify kwamba kuna mama anazaa. Ametolewa kwa barabara akaingizwa kwa nyumba yangu. Na kuingizwa mtoto amezaliwa. So I want to ask you, wakati mtoto alizaliwa, all those procedures of atoke kwa tumbo, hata tuanze kumweka kwa breast ya mama, breastfeed the first time, we had to do it with confidence, with the little knowledge we had gotten. Na huyo mtoto ameishi hadi leo. So there are so many challenges in the community. When I talk about community advocacy, is a lot of any strange occurrence can happen anywhere. Mama alikuwa anaenda clinic, huyo hangefika. Ali stop around my place. And because I'm a community person, anaingizwa kwa mama kijiji. So do you see? Yeah. There are a lot of challenges. In as much as the health facility was there, she could not access it. So tulisaidia kudeliver yule mtoto. Tunaambiwangu wa mama tunabeba nini? Si mnajua zile vitu tunaambiwa kwa tunabeba. I had to rush to the nearest shop to buy some goods.
No, mimi sijui. Tunabeba nini? Tunabeba nini?
Tunabeba, see the basics. Basics, our nutrition, our professional.
Iseme.
Sisi tulifunza, mimi nilikuwa nimefunzwa kubeba wembe, a clean wembe. Nitasema tu vile iko. And a string, a clean string. And a lasso. And that is why in most of our handbags, even if you get to my handbag right now, you will get a clean scarf or a clean lasso, because you could be walking along the side and you get a mother who is delivering and you help her. But this time it was in my house. I have come from where I work and I have rushed into my house. So I went to the nearest kiosk. There's a kiosk by where I live. Nikamwambia nataka wembe and you're not going to charge me. Nipe wembe. Akanipea wembe so that we go finalize the what? The process. And we finished that process, but I had to call a lady who was working at a pharmacy nearby for the next intervention. So, breastfeeding that child, I look at that episode and I'm like, oh, those were golden moments to make a life live on. So, mtoto ni wa village, as Maureen says, mtoto ni wa community. Hata wewe kuzaliwa ni bahati. How many of us know that the first time they ever got latched onto their mother's breast? I'm allowed to say this because I'm a grandmother. Thank you.
Thank you so much, Mercy. And back, this is the CSA table where we listen, connect, and learn. And I've actually learned that is what women carry. And that is why we are having this podcast series. It's intergenerational. I'd never known that, Mercy, to be honest. Now that I do know, I'm still going to research to know better if there are any clinical things that we ought to know so that we do not spread misinformation, so that not anyone and everyone can be able to carry that. That's one thing that I'd like to say also as an advocate. Now, to what the government is doing, there is Pumwani Human Milk Bank. A very good initiative. And I feel like Kenya does not need more policies. It needs scalable interventions like Pumwani Human Milk Bank. I can imagine when you were struggling maybe to breastfeed, you will have needed something like that, right? Because again, it offers donor breast milk to infants who do not have access to mother's milk. Their kids, when you may lose wazazi wao. Then there's the Mother Baby Friendly Initiative Plus model, which bundles clinical and social care. You've all talked about the postpartum depression. This again brings in the kangaroo mother care, your skin to skin contact with mental health checks. Why can we not scale that for the mother as well to get the mental help they deserve? Another scalable intervention is National Maternal, Infant and Young Child Field Nutrition, the MICN strategy 2023 to 2028, which protects breastfeeding by enforcing breast milk substitutes. But then, Lillian, is it being really enacted kwa ground?
Now, if it was enacted, I would be here with my baby because it would have been very comfortable for me to just stop, pump, or stop and feed. I'm currently struggling with full breast right at the moment. And anytime that I leave this place, most facilities, like if you don't have a friend who is at the CBD or who is near the CBD, as a mother, when you leave your house, you'll not, the only other place that you'll be able to express in ama kukamua ni kwa choo. Now this means that you'll have to go and press it. It happens. You press umwage chini, jumatiti itakuwa imejaa sana. Now you see the BMS on paper is very nice. Very nice. It actually supports mothers. It provides for breastfeeding stations in major cities like Nairobi. Like the CBD, hizo vitu za kukaa, we should be having like a small space that is safely secured for mothers. But we don't. Watu hawkers wamejaa. I'm sure people have lot utasema ati lazima watu watafute, shilingi itafutwe. But again, shilingi kitafutwa tunafaa tunakuwa tunachunga the next generation. So this mother who's come, let's say ametoka hata nyumbani, amekuja anangojea mtu akuje ampik. They want to breastfeed. Not everyone has confidence to go and sit somewhere and remove their breast and breastfeed. So napata mtoto atasikia njaa ama mama ata opt kununulia mtoto maziwa. Jo anaogopa kutoa matiti mbele ya watu. Kwanza you see when you meet someone who's come directly ushagwa mkuja Nairobi for the first time, best believe watatoa matiti. Wataogopa. Hata wa Nairobi, majority of women in Nairobi, even the women that I deal with, they will not be, they'll tell you, I'm Tanu, me, maneno ya kutoa matiti publicly, I can't, you know. But you see, the BMS provides that omama wachungwe. Formula, like easy formula and substitutes zikwe controlled. Yes. The other conversation that we had, ile walikuwa anasema ati mtoto amezaliwa, mama ana travel, so lazima wapewe formula. You see, that is misconception that is actually now promoting the substitute bila kujua. But you see, if BMS was actually implemented where the mother knows that hata nikienda job naeza kamua saa 4 without being discriminated, naeza pewa 1 hour, naeza toka kwa station yangu ya kazi na nikae mahali 30 minutes nikamue maziwa na nisikue laid off. You know, unfortunately now the companies and the organization and the facilities, majority of them actually discriminate women after you get pregnant. Wanakuona kama liability. They see that wanakulipa for hours that you're not going to deliver. Because now if you know your rights, you will actually ask for like 2 hours or 3 hours per day to go and kukamua. Unaona? But majority of people, when you tell them that allow me a break after every 3 hours, ama 4 hours nikamue, ama 30 minutes break after every 3 hours, hata kuenda kwa choo stand choo, people will start now asking you that unakula into their time, and they will actually expect you to extend ufanye overtime so that you can cover for that time that you went for the extra 30 minutes. Now this now brings in the challenge, because BMS was enacted to support and to make sure that the mothers, the women who are breastfeeding, are actually able to comfortably and I'm not saying luxuriously, but comfortably breastfeed for at least the 6 months without interference, and to make sure that hizi zinafanya inakuwa ngumu zimepungua.
Waweze kuendelea ku breastfeed. Na hapo ndio I want to also advocate and give a call to action. Ensure you as an employer, you have a lactation space. Please. And you know, I'd like to applaud Nakuru. They did champion for the healthcare workers at a level 5, and they opened a lactation station because they saw that gap, and I thank you for bringing that up. And Maureen, as we are getting to wind up, I want to know better your feeling as a mother when you're alone in that room, and when you were alone in that room. What will success look like for you to say, this is the support I inherited and the systems were really there for me? And if not, how would you want it to look like?
I think the biggest success for us parents, I'll speak as parents, for children with disability, it's financial. When you are financially challenged, it's so hard for you to like even care for that kid. You see, we have like sessions for therapy. Therapy requires you money, requires you time, and requires you to like travel from one point to the other. Like where I live in, the only facility that I can access for therapy is EPDK. Now you can imagine from Kirui to EPDK with a kid with special needs, na ni mkubwa kukuliko, hatende, you have to like carry that kid. Another thing, I also think the food. These kids need like balanced diet. They need the best of the best nutrition intake more than even the other kids, because at the end of the day, mtoto haezi jitafutia. I can compare with my second born. My second born son is 8 years old. My second born anaweza toka kwa nyumba na aende apate embe ale. But for the other one, you have to, like, you as a mother, you as a caregiver, know, like, these kids need some fruit. You have to, like, feed them. So I think the best and the comfortable point of us as a mother or as a parent, I think, is financial stability. Once we get like that financial stability, I think we can move on well. And another challenge that we face is, mimi siwezi enda kwa ofisi niombe kazi. First, if I go and they like not like I have a kid with special needs, it's also a challenge for me, because atakuwa zile za you'll be asking for leaves. How are you gonna cover those times that you are outside there? For I think as a government or any facilities, let us come up with something like a mother can generate or a parent can, let's say a biashara. I believe wanasema wametupea nyumba za bure katika a city, but I believe it's hard. It's hard for, like, yes, umenipea, but how am I going to access these facilities? How am I going to, like, sell these things that I have? And also think tax exemption. I don't know if it's still there, but for us, we've struggled to, like, being accepted by the tax. It's hard for us. Mimi ninalipa tax, niko na mtoto wako hapa, anahitaji mahitaji ile ambayo ni mingi kuliko hii tax nalipa. And at the end of the day, I'm also paying that tax. That tax should support me. So I think the best support system we, like, need, we as parents, is something that can generate us income. Hatuombi. I believe some of us, or most of us, ni wale wenye wamejificha hawakuji kuomba, because we, like, want to stand on our feet. We, like, have to support this kid on our own, but we need that support system from others.
So financial accessibility and sustainability, when it comes to that. Lillian, I want to come back to you to just give us your parting shot as you tell us, what will successful feeding look like in from the hospital to that quiet room of that mother from a healthcare perspective?
Now, as a healthcare provider, of course, success will be the mother leaves my facility or my office or my consultation room with awareness that they can breastfeed and comfortably breastfeed, and they're able to reach out. You know, they are not independent. The independent story that has been currently in a somewhere where women are supposed to do it alone, they're supposed to do it solo, they're supposed to champion and do everything. That one should be discarded when it comes to matters. Venye amesema kulea mtoto ni community. So I think the best way would be una release mama, they go home knowing there is support, knowing there is someone that is going to take care of them. Hata kama ni shosho, hata kama ni nani, so this mother can be supported to breastfeed. Another thing is on, now when this mother is knowledgeable, ame understand to ajajua, you know, like I've told them the benefits of breastfeeding. I've tried and showed her how to breastfeed, how to latch, how to make sure she's well hydrated, she's well nourished, to make sure that she tries to sleep. Akienda nyumbani, she can translate the same. That will be very successful. Kwa sababu hii ya word of mouth, mama ukiana ujue, say tuko social media. Mama moja akipost kwa group, let's say uko na wanawake like 1,000 kwa group, mwanamke moja aseme hiyo breastfeeding ya 6 months, hiyo ni story yao healthcare providers, haiwezi work, alafu ipewe thumbs up, ama watu wa kadhaa million like likes, watu wa interact waseme hiyo ni siasa, tupo watoto uji. Ulisikia mtu akisema watu wanapewa uji, wanapewa formulas, wanapewa any other feeds. So success will be translating what is practical to what is currently being done. Yani whatever we are doing, whatever we believe and whatever is science, inakuja inamajiwa, and then that will be it.
You've touched on technology, you've touched on science, you've touched on knowledge is power, but then you have to have discernment to actually phase out what you should not be taking in, right? And this year's global theme is breastfeeding for sustainable start in life, strengthening what works. So beyond printing of t-shirts, na women rep akuja ashike mtoto apige picha hapo na hizo ma 60%, all these statistics, masi ukikafunga. Community, you know, we share one thing with you, community advocacy, and we are always loud speaking about the uncomfortable truths, and where I sit is the intersection of community and policy, and I always like bringing these lived realities to the policy table. Afadhali nifukuzwe, but bora nishasema. So what do you have to say?
Thank you. What I have to say as we part, I want to say there's so much, it cannot fit in one podcast. But I want to minimize it. We've talked about technology, we've talked about this, but let us break the taboos that have been even going to school and learning and being told about all these policies is becoming a taboo because they're just there, but they're not working on the ground. Secondly, let us use the helplines. Maureen has talked about social welfare, which is very minimal back in the community. So can we now stop talking about social welfare and implement? Because I always say, much talk without action is nothing. Let us act. We, even the policy makers, let us act. Go do research, not even do research. Do not now stop at doing research. Go to the community, work with the community mothers as early as today, and you will experience a whole world. So let us have a breastfeeding helpline. If we don't have, because we talk about nutrition for babies, for our newborns, is what is building our foundation. A house without a good foundation, what happens to it? So a newborn without a good foundation, nutrition-wise, what happens? Let us create a breastfeeding helpline 2026.
I love that. Thank you so much, Mercy, and all the guests. And as I wrap up, I've gotten 3 key highlights. One size fits all trap does not work for the community. Advocacy campaigns, we have to move from generalizing it for every mother. We have to look at what is the specific needs of each mother, then advocate from that point of view. Then again, one thing that I'm going to be calling out is the 7-day performance. I really do not like it that we do have a week-long campaign. Then we we talk, we do, we run, posters, t-shirt safi, tubebe watoto wawekwe kwa MYCN card, and then we shut up until the following year.
One more thing, sorry. This is not an etiquette in cutting off the podcast.
It's okay.
In the community, let us have those lactation centers. In the sokos, in our markets right now, pass by the soko nearest to you. There is none. And we have our women in the sokos, in the markets, and they're carrying their babies. And they have to look for an income because an income is very prime in your life and my life, as Maureen even correctly puts it. So let us have these lactation centers, even in those public transports, if possible. This is Mercy's, way of doing things. Let us have a lactation seat for mothers preserved there. Thank you.
Thank you so much. You have not even cut me off. You've actually said the third thing, which is about the systemic pressure that I want us to continue speaking about, because it should be called, people should be called out, people should be accountable, and the people is we, but the government has to remember that we are the ones who elected them, right? So the taxes that we do pay, the county budget has to reflect in the community, yes? So as I do wrap up, one thing that I want to say, as not a founder of CommWave by Chalet or the Sun CSA Table Talk host, I want now to speak as a food systems advocate. I want to put this other hat aside. Breastfeeding your kid is a sustainable food system. It's cheap, it's accessible, it's sustainable, and it has its advantage, and it's safe, thank you, and the start of a sustainable food system in the whole world. And if you feed someone vizuri, si ushaanza good food system. Yeah. Hakuna mambo ati imetoka kwa factory, hakuna waste, si imetoka kwa mwili ya mtu, and it provides optimal nutrition. So the uncomfortable truths that I'm going to commit for me, to our dear listeners, and to you as the mothers who are here, I'll continue championing for that. I don't want policies that are just written, implemented on paper, but not reflecting what is happening on the ground. I want to see more counties doing what Pumwani has done. We want to see these lactation spaces. We want to see more investors doing investments and strategies that the community is actually doing. Msikuja hapa mnasema you want to implement this, but it does not work for that community. So that will be my personal commitment as Charlotte, policy, advocacy, communicator within the food systems. And in one word or 2 words, your commitments as I wrap up the second episode. Maureen,
Yes.
your commitments from this.
I think my commitment is to advocate more on disability, especially those kids from birth up to the age that the Lord will just give them. My commitment is also to let the society know that these kids are supposed to be loved, to be welcomed, and to be treated just like any other kid. To let us embrace them just the way they are. And for our mothers also, let our kids be known, kwa sababu tukiwaficha hakuna vile society tatu accept without them knowing them. Yeah.
Thank you so much. Lilian, ndio usipigwe vita. You can try to be politically correct, but I'll tell you to be truthful.
Yeah, be very truthful. So as a national advocate, I can commit to pushing what I've been doing, to pushing for proper use of nutrition and integration of nutrition. As we are championing for breastfeeding, you have highlighted a very good thing, saying that it's safe and all that. But let's also remember that as a country, we are fighting a lot of issues when it comes to health. Our health system is jammed, it's burdened, iko imeja. One of the things that we can use to actually try and reduce these NCDs that are really rising every other day, even the communicable diseases, is breastfeeding. So yes, we are going to commit to actually now fighting, pushing and pressure. We will talk about it. I will talk about it. You'll see it. And those who I will talk about, me, I've committed to that. So we're going to make this. We have to make it work for mothers like Maureen, for mothers like myself and other mothers. You know, me, I might be advantaged because I understand why nutrition. I understand why breastfeeding. But for that mother who does not understand, for that mother who is hiding, for that mother who is struggling and does not have support, we are going to push for them. That is a commitment I'm doing.
Mercy, in less than a minute, you are a very good advocate, but I want you to give us a clear punch.
Clear path. My commitment remains, as I always reiterate, voice and action. Voice and correct, appropriate action wherever I am at. Be it out there in public spaces, be it privately. Voice. I never stop to advocate for the right things. Voice about breastfeeding the correct way. Voice about what is not happening, and action. Just voice without action is dead. Thank you.
Thank you so much. And as I always say, advocacy without action is just noise. And I'm going to call on to all of you to continue advocating with purpose, deliberately, until we influence the systems that should actually work for us. My name is Charlotte Kirui, and this was the second episode. Thank you for listening.